current senior and majoring in Bachelor of Science in Healthcare Management, and I'm the current president of Student Government Association. So on behalf of Student Government Association, we would, like to welcome you to the second open house, and hopefully you get a lot out from the panelists. So today for the panelists, we actually are majoring in all different section of healthcare. So hopefully you will be able to get your answers from whether you're interested in PA, healthcare management, pre-med, pharmacy, etc. So why don't we just introduce ourselves real quick, starting from Elizabeth.
Hi, everyone. Hi, everyone. My name's Elizabeth. I graduated with my pre-med health studies degree in 2020 and finished the PA program in 2022 this past May. And I just started working as a family medicine physician assistant in Southern New Hampshire with Dartmouth Hitchcock.
Hi, everyone. My name is Ryan. I'm a current third-year pre-medical health studies student, and I anticipate on applying to medical school next year.
Hi, everyone. My name is Kiro. I'm a fifth year in the PharmD program, so this is my last didactic year. I am from Hopedale, Massachusetts, which is like near Worcester, if you guys ever heard of it. And as you can see, the scrubs, they have a shift later at Boston Children's Hospital. So yeah.
That's very exciting. Okay, now let's, Elizabeth, let me start with you. What made you choose healthcare? Like, why were you interested in pursuing a career in healthcare?
So I grew up with a physical therapist as a mom. So I was introduced early on to just, healthcare in general and going to work with her in her hospital in New Hampshire. So it got me thinking about it. I learned what a PA was my junior year of high school. Had a knee injury. My ortho provider was mostly a PA. Only saw the surgeon when I was about to be put under for sleep for the surgery. So my PA was who took care of me, and she kind of taught me about the role. And I started doing a little bit more research about how, flexible of a career path it is. And just medicine in general, I kind of love the fact that there's always so much more to learn. You never know it all. And you can just move through it, freely with the PA profession.
Oh, no, you're good. Ryan, do you want to add on to anything by any chance?
Sure. So the reason I chose to go and commit my studies to healthcare is similar to Elizabeth. I believe that you are molded from a young age. You are defined from a young age of what you want to do for the rest of your life. So I was exposed to the healthcare environment at a very young age. My grandfather was a pathologist. He worked in pathology. My mother is a nurse as of right now. A lot of my mother's side of the family was in medicine, so I gained a lot of exposure to that early on in my life. So that sort of molded me into the role of wanting to take after their steps, go after their footsteps, and really commit myself to a lifelong service of helping others in need.
Kira as well, do you want to add on to anything?
I guess for me, I really worked in a Walgreens when I was in high school. So I kind of got to see like that really high intensity profile of healthcare firsthand. And I got to work with patients at a really, really young age. I was a really big fan of that. So I wanted to do something with that in the future.
Thank you so much. For me, I don't know if a lot of you guys can relate, but straight out of high school, I actually didn't know what I wanted to do. I felt like I had so much to explore, but I always knew I wanted to get into healthcare because, again, like they've mentioned, it's always in high demand, and I just wanted to have a career where I can help other people as well. However, within healthcare, there's so many job opportunities, but I didn't know which one specifically that I wanted to pursue in. So that's actually one of the reasons why I chose MCPHS, because all the majors they offer here are healthcare specific, like oriented. So I knew that if I came here and let's say like I decided to pursue my career path in some other healthcare, I would be able to switch my major easily because the credits would be transferred is easily. I know that was a redundant word choice, but also just along with medical area of how we are surrounded by all these big hospitals, institutions. So I knew that I would be able to be exposed to a lot of more healthcare job setting or just opportunities in general for me to learn what I wanted to pursue in the long run. But thank you so much for answering, panelists. Now let's just talk about college life. As I know you guys are very academically rigorous. I know you guys study really hard. However, what do you guys do outside of MCPHS in the Boston area? Why don't we start with Ryan?
Thank you for the question. So outside of my academics at MCPHS, I really enjoy exploring what Fenway has to offer. I come from New Hampshire, of small town New Hampshire, Hooksett, New Hampshire. So there's not a lot to do around my area. So when I came to Boston for the first time, as an independent college student, seeking to make friends, explore the city, I found myself really going out a lot when I had the spare time, really exploring what Boston had to offer, what sort of entertainment I can indulge in, and what else I could do while making new friends and forming new relationships. So I find myself taking advantage of a lot of the stuff Boston has to offer. Through our institution, we also have discounted movie tickets, discounted activities that we can partake in as college students. One of the first things I did at MCPHS after my first chemistry exam was I went to visit the Boston Aquarium. That was a very surreal experience for me. I went with some new friends I made. We decided to go together, and it's just one of those experiences that you seek to cherish, in your college years. You want to sort of get out there and really make the most of your college memories.
I'm a really, really big sports fan, Boston sports fan. So Celtics and the Red Sox are right in our backyard. What me and my friends always do is we used to go to TD Garden. We used to go to like one of the restaurants around. We used to like eat out or something and wait for the tickets to get to like $16, because like it's really, and then we'd go in really cheap. Other than that, we also like have tickets with the school. Like Ryan did mention, next Wednesday I'm going to the Pistons game. MCP had discounted tickets for that. Personally, for me, just having these sports around and being available to everyone is really, really cool. I also I'm an RA manager at the residence hall in Emmanuel, and I live 5 minutes away from where the Red Sox play. So I'm really, really excited to be there, and like everything is really, really close. And just having fun, having both that, like you play hard, but you also work hard is really fun. So that's like personally for me, what I do on the outside of MCP. Yeah.
Thank you so much. I can definitely relate. Elizabeth, do you want to add anything or are you good?
I'm good.
Okay, perfect. Okay, perfect. Just to add on for me as well, I love the Boston area. I don't think it can get any better personally, because for my high school, I actually went in the middle of nowhere. Actually, a cow farm was right next to my high school. I am not joking. I went to a high school on an island. So coming to a school in a city area really opened my eyes more, because I'm the person who needs a really good work and life balance. And outside of school, there were so many opportunities, like Raiyan and Kiro mentioned, about like sports games, just restaurants. And also as an MCPHS student, you get so many discounts in like various museums or just upcoming events in general. So I was never bored, and I was able to just have fun, experience my college life, and yeah, just was able to distress outside of my academics. But moving on, Elizabeth, this is a question for you, since you are graduated and you have a job as a PA. How did you think that MCPHS prepared you for your career?
Overall, very well. I think, once I hit the graduate program for PA studies, the focus is really on, preparing you for your board exam when the program ends. The way the program does this well is that they start structuring all your exams within the program to become more similar and more similar over time to the board exam questions. So they start preparing you so on the day of your exam, you're not feeling totally, hit by a curveball. You do rotations in every kind of area of medicine, and you get to choose 2 elective rotations in areas that you're interested in. So this prepares you by letting you have a sense of, what you like, what you don't like, so that when you're done with the program, I would love to apply for like a surgical position, or maybe more of an inpatient hospitalist position, outpatient ortho. I felt like I was exposed to most areas that I would consider applying for jobs in. And once I got out, I felt like my training at those clinical rotations was extremely, helpful. And by the end of it, I felt like I was able to be independent when I started practicing. I was just ready to actually be a PA and not a student anymore. Yeah.
Well, thank you so much. Moving on with the current students, Raiyan and Kiro. So I know you guys already mentioned about your various leadership positions within the campus, but do you mind elaborating what other positions you are in and how you think those positions help you with your future career?
Sure. So, one of the current positions that I'm currently having the privilege of working in is as a peer mentor. So, what a peer mentor is as an upperclassman, I'm tasked with mentoring a class of first years within the same major as me. We have what's called an intro to the major class, which is a first year, first semester seminar for first year pre-meds who are just getting introduced to their major. And I'm paired in their class with the responsibility of mentoring them through successfully working through their major, avoiding common mistakes as a first year pre-med, and really practicing the lifestyle of a well-rounded student. You know, this position in itself was very rewarding to me. I interact with these students of mine on almost a daily basis. I see them in the hallways. They say hi to me. I say hi back. And every week when we have class together, I always have something to offer to them, whether it's a word of advice, whether it's valuable information to hold on to, and really guiding them towards being not a perfect pre-med, but one pre-med who's willing to try and put in the work in order to get towards a graduate program. Of course, all pre-meds have the goal of getting into med school, but with the right mentorship, with the right connections, and with the right focus, I believe that these pre-meds of mine under my mentorship will be able to lead a successful career in college.
Yeah, so on campus, I'm also an RA. So like I said, I live with a bunch of freshmen. It's really fun. But the other thing I do is I also like to, build on my healthcare experience. So as you guys see, I work at Children's Hospital as a pharmacy intern in the inpatient pharmacy. So I work mostly with ICU patients as well as NICU patients. And I make their medications for them after the pharmacist has verified the orders. That's like my thing. If you have any more questions about like pharmacy in general, I'd love to talk after to elaborate. In the summer, I did an internship at Vizient Incorporated in Texas. They're a group purchase organization. So what they do is they like negotiate pricing and drug distribution and things like that. And I worked on their consulting end as well. And lastly, I did some research as well at Brigham and Women's Hospital. So I was able to contact the doctor there, and we did some pharmacist-based research to make sure that if a pharmacist is in a discharge position and is discharging patients, how much would that be for the healthcare system that they're in, and if that's going to reduce like hospitalizations and things like that. So I did a lot of healthcare related things, and as you guys can see, like the reason is it was because I was here. The reason is because I lived on campus and I was 5 minutes away, and it was like, if there's a shift at Children's Hospital that I can pick up, they're like, oh, you're like 5 minutes away, come down the road. So honestly, the area itself has offered me mostly a really beefy resume, which is really nice, and has offered me also to see a lot of patients and a lot of exposure to healthcare, which I don't think I would have gotten if I went to like a school anywhere else.
Thank you. I also can agree with that as well. The opportunities around MCPHS is endless. Like, is there any international students here by any chance? I doubt it, but okay, I expected it's going to be mostly domestic, but even as an international student, we are actually we cannot work outside of the school without a CPT visa. However, regardless of those restrictions, I was able to obtain a lot of opportunities by volunteer opportunities or just internship in general, because the professors here, the faculties here are usually working at another institution outside of MCPHS, for example, Brigham Women, CVS Pharmacy, Jocelyn Diabetes, etc. So just by going to the school, I was able to network with various faculties and was able to, get other opportunities to, enhance my resume and just build up on my skill as well. And also, I remember when I was in high school, I was very involved, and that was one of the concerns I had when I first came to college. I was worried I want to be involved as well, but I don't know where to start. However, the MCPHS orientation team, they actually prepared me really well, because during one of the sessions, they actually have a student leadership one-on-one session towards the welcome week, actually, and they give it entire flyer of listing of all the student leadership opportunities where you can start as a first semester as well. So that really helped me take a step in. Take a foot in. I can't think of the right phrase right now, but yeah, that really helped me. And also just mingling or talking to the current students, even in these sessions. If you guys have any questions in terms of like involvement, you guys can always come down here and ask this question, but just asking a lot of questions around really helped me as well in terms of involvement. But Elizabeth, I'll toss another question to you. What kind of opportunities for employment were there after you graduated from MCPHS?
Not just speaking from a PA perspective, but overall, like overarching perspective, our school has an extremely high rate of employment within the first few months of graduation. Certainly, some students like self-select to take a little bit of time off, which is good. My experience at the end of the PA program was you finish your rotations, you prepare for your board exam, and then once you get your certification, you can start applying to jobs, or maybe you have already started applying. Healthcare is a booming field, especially post-pandemic. We have, such a need in these hospitals and these clinic settings. There's really not a better time to get into healthcare, no matter what your role, what your ideal role will be. There's a nursing shortage, there's a provider shortage, a support staff shortage. So, it's going to be, the world is going to be open to you after you finish your schooling, and you're really going to have such an amazing selection of where do I want to be? What do I want to be doing? What setting do I want to be in? Whereas I think maybe before, in other certain jobs that are not healthcare related, you might be a little bit more limited with like, I want to be here, which means my options are like this. Whereas healthcare, you can choose where you want to be, in what setting, and in what field. It's a pretty broad and open idea. I got hired very quickly after college. I signed on in May before I even took my board exam. So it really wasn't a struggle for me personally, or anyone in my class that I had talked to, really.
So we can start from Elizabeth again. Why should the students apply to MCPHS?
I think most of the questions we've answered so far should kind of like culminate, with an answer in your head about that. Just being that it's a healthcare oriented school, if you have any desire to be in this field at all, I really think there is not a better school to be at. You can change within the school your majors. If you're someone who's not committed to one thing at this time, the first and second year of almost every single program that we have are very interchangeable with what classes you're taking, what credits you're taking. And if you decide down the road, after your first year, you're rooming with someone in dental hygiene and you find that you really love what they're doing, it is an easy process to switch your major. I think that's a benefit that really needs to be just talked about when you guys are, still in high school and thinking about these things. Otherwise, I just think, highlighting the benefits of being in the area that we're in. Like Kiro said, he just has an amazing resume from all the connections he's made. Boston is a healthcare capital of the entire world. People come here from, internationally to be treated and to work here in the hospitals here. So, you'll walk down the street to any number of the institutions. They know MCPHS students. I go back home in New Hampshire, they know MCPHS students, and they love how prepared we are when we start working for them. We have a good reputation, and I think that should be one of the reasons why you send an application in.
Yeah, so really for me, why you should apply to MCPHS is because of the school itself. Really, this school offers such a unique sense of community and a unique sense of belonging. Really, my first year here, I felt automatically attached to everything the school had to offer. Although my classes were smaller, it gave me more of a chance to form more meaningful connections with my peers, with some friends who are potentially going to be lifelong friends of mine, as well as professors who I have very good relationships with. This school gives you all the soft skills you need in both academics and extracurricular activities that you need to advance into the professional world. I forgot to mention that I do currently hold a job at Mass General Hospital as a unit coordinator, and it's because of the soft skills that I earned with MCPHS that I was able to be offered an interview and offered admission into this job. They saw my resume and it's like, oh, you go to MCPHS, tell me about that. And really, I got to elaborate on how meaningful my experiences were here in both my classes and extracurricular activities and what it gave me in the long run as a person trying to grow myself in a professional manner and trying to develop myself in a way where I can advance into this world of healthcare.
Yeah, just to add on to Ryan, as I said, I work a lot with first and second year students as an RA. And I think the community thing that he talked about is huge. The fact that everyone around you is a healthcare major is something that gives you kind of like a motivation and a sense of community. There's no one that doesn't have work to do. There's no one that has an exam. Like everyone is, oh, we have an exam this week. Oh, me too. I have an exam this week. So everyone kind of has like, the trauma together of healthcare. So healthcare is a rigorous, difficult thing to go through, and going through it with a bunch of people around you that are doing the same thing, that have the same exact goal as you, should be the biggest motivation to go to MCPHS. There's no school that has just healthcare. You know, we're one of those places that are doing that. And I think that personally, when I see it with those first and second year students succeeding in their fields, is having that community around you and having people around you that are all with the same goal. And of course, the Boston Longwood medical area has to be like one of the nicest things ever. I had a professor of mine that told me that he went to a school that's a little bit out in Western Mass, and he's a pharmacy major. He told me that how difficult it was to learn those soft skills, to go into the field and, you know, talk to pharmacists and to learn how to talk to doctors and physicians. And, you know, as a pharmacist, you have a certain role within the healthcare field. He was like, learning that role and doing that was a big challenge because he didn't get to work in the area. He didn't get to do any of that experience, right? He only got to do that towards the end with his rotations. Here, you were immersed in that field. People are working from, you know, first or second year. People are doing things on the side. People are volunteering like Ryan is doing. So those are things that should tell you that, like, if you want to become a healthcare provider, I think this is the place to be.
Yay, thank you so much. My reasoning behind why you should apply to MCPHS are very similar. Obviously, I want to emphasize the healthcare oriented part because personally, I am pretty shy when it comes to making friends. So coming to college, I was kind of nervous how I'm going to fit into this new community. However, because everyone is in healthcare, we have the same interests at the end of the day. So it was pretty easy to find a community. I didn't feel like an outsider at all. So hopefully, if you guys are nervous about coming to the new community as well, beside all the advantage of career-wise, MCPHS is here for you. You will be really prepared, and then I hope you enjoy MCPHS if you do end up applying.